Hi, it's Dr. JJ here on the set of Home and Family, and I just wanted to give you a little bit more information and follow-up about kids' legs and feet. First of all, toe walking. At the top of the show, we talked about little Alexandra on her toes yesterday on the show. Now, most kids will walk on their toes for about 3 years. The reason being is that once they feel like they can get on their toes, they can see a little bit more of the world, and before you know it, it becomes a habit. The key thing is if they can get their heel down on the ground and walk flat in their shoes, then we know there's nothing wrong. It's just a habit, and it's usually outgrown by 3 when they're distracted and involved in other things. However, there are some kids who have such tight muscles in the back of their shin that they have elevation of the heel and they can't get it down on the ground. So if your kids can't get their heel down on the ground and walk flat even for a few seconds at a time, or if putting the heel on the ground causes pain, that's a reason to consult with your doctor. And usually physical therapy and stretching are the usual fix. Sometimes casting may have to happen if there's other global problems leading to why those muscles are short. Second of all, femoral anteversion, when the thigh bone is rotated in. Again, all kids do well with that, and it's only rare that we will see that a teenager may have such severe toeing in from that they require what's called a derotational osteotomy, or a surgical correction of the rotation of the femur. So don't worry about that, and get your kids into skating and ballet and things that help turn the axis of the legs out. As with internal tibial torsion, which is the lower leg, as in the case of Ken's little Margot, again, that is something that is corrected on its own. And interestingly, years ago, kids were put in what are called reverse last shoes, which means the right shoe on the left foot and the left shoe on the right foot, separated by a rigid bar at night. It was a form of torture. And actually, for those kids who had the same condition and didn't have the bars and shoes, their outcomes were the same. So that's an outmoded treatment, and don't let anybody tell you that that's going to be necessary. Kids are also born with a lot of crooked, crinkly toes that might overlap or look kind of like old lady craggy toes when they're born. And again, that's from uterine position. And once kids are crawling, walking, cruising, and getting their feet planted on the ground, they're spreading their toes straighten out, and as long as their shoes fit well, we don't have to worry about that condition. And lastly, bowed legs. Now, bowed legs are common to all babies, especially when they're first walking. Again, part of the reason is that the muscles on the middle part of the legs aren't well developed because they're not weight bearing. Once they get up and start walking, those little muscles sort of even out the forces of their legs, and their legs straighten out. And face it, if kids are in a diaper, it's a lot easier to walk when you got bow legs. There's a little bit more room for the diaper. So don't worry about that. When to worry? If the bowing is only on one side and not the other, that may indicate that the growth plate in the shin bone on one side is growing unevenly, and that certainly is a reason to go to your doctor. And the second, and very rare now, is rickets, either from nutritional or genetic reasons, and kids have progressive bowing that gets worse and worse, where the knees are literally out here. Those need to be remedied by the specific specialist if there's a kidney issue with rickets, nutritional rickets, and those are solved by the experts in their field. So the good news here, backing up, is that all kids look a little wonky when they're walking. Enjoy the process, make sure the world is safe around them, give them a nice surface to walk on, let them walk barefoot as much as possible because that fosters the development of all good musculature, and just enjoy the ride.